my name is Megan Quinlan. I am a student physical therapist assistant at Kennebec Valley Community College. And today I'm going to be doing an in-service on the topic of whole body vibration. And is whole body vibration an effective treatment to decrease spasticity in post-stroke patients? My objectives for this presentation are to go over what is spasticity and what is whole body vibration. And then I will look at a few different studies surrounding this topic, and then go through some conclusions, and I'll have my references listed as well. So just a review, most of us I think know at least a little bit what spasticity is. Spasticity is a velocity-dependent hyperexcitability of the muscle stretch reflex. So there's exaggerated tendon reflexes along with increased resistance to passive movement. So anytime you're taking a patient through passive range of motion, the faster you go, the more tone you will experience, the quicker it will, the reflex will kick in. And there is hypertonia, which is resulting from an upper motor neuron inhibitory control. So that's that. And then spasticity is most commonly arising from stroke, cerebral palsy, multiple sclerosis, and spinal cord injuries, or any other central nervous system lesion that may be going on. This is dealing with an upper motor neuron inhibitory control, so it would be part of the central nervous system. A few of the impairments that are typically caused by spasticity would be shortened muscles and connective tissue, any kind of reduced active range of motion, passive range of motion. They're going to have less range of motion available. Voluntary limb movements will also be reduced, along with an impaired gait stability and typically a slower gait speed. And then, of course, all of that leading to restricted activities of daily living. So what is whole body vibration? So I'm focusing more on the whole body vibration, but there is more of a focal vibration therapy that can be used as well. And so the vibration therapy in and of itself would be a low amplitude vibratory stimulus applied to any part of the body, whether it's a specific area or using a platform which would target then the whole body. So the way that it works is it's going to stimulate the muscle spindles and alpha neurons, which is then going to initiate a muscle contraction, which this results in effect similar to conventional strength training. So the vibration is gonna alter the excitability of the corticospinal pathway, as well as the inhibitory and facilitatory inputs. So spasticity, we're dealing with a hyperexcitability of those inputs and a lack of inhibitory control. So the vibration is going to alter those in hopes to sort of balance them out. So whole body vibration can be used for a lot of different things. You'll see, if you were to Google whole body vibration, you'll see a lot of athletes are using them as a way to do strength training, and there's a lot of different ways. Particularly for therapy though, it can be used for trunk and postural control, either by sitting or standing on the platform. It can be used, as I mentioned, to target specific areas to decrease spasticity, either in your upper extremity, lower extremity, or like the whole body by using a platform. So it can be used to decrease spasticity, and static or dynamic exercises can also be used in conjunction with the vibration. And it also can be used for balance and proprioceptive training. So the first study is actually kind of a combination of two different studies. It's done by the same authors, and the second study incorporated another outcome measure into the study. So this one is going to examine the feasibility of using whole body vibration in a seated position for those patients that may not be able to tolerate a standing position. And it's also going to examine the effects of whole body vibration on the excitability of those motor neurons using an F-wave parameter. So with this study, there were 25 patients. They were seated with their hips at 90 flexion, 0 extension, and maximum dorsiflexion. So just basically picture sitting with your legs straight out and your toes pulled back. So they were seated, relaxed for about 5 minutes, and then they received 5 minutes of vibration on their hamstrings, their gastrocs, and their soleus. So the plate was sitting right underneath them. And let's see, the frequency they used was 30 hertz at a 4 to 8 millimeter amplitude. And again, this was for 5 minutes. The outcome measures that they looked at were the modified Ashworth scale, active and passive range of motion measures, as well as the F-wave parameters that were measured with an electrode. The measures were taken at baseline right before the treatment, immediately after, 10 minutes after, and 20 minutes after. So you can see this is an image of the way that the patient was set up. So you can see in the second image in the B, the therapist is manually providing full dorsiflexion in the ankle, as well as full extension in the knee if necessary. And so the patient was positioned this way for 5 minutes to receive the vibration coming up through that plate. The results here showed that there was no pain or discomfort at any point before, during, or after in this seated position. So that's going to show that it is feasible to use whole body vibration in this position for patients that cannot tolerate standing for prolonged periods of time. And the results also showed significant decrease in the modified Ashworth scale in all of the muscles that were examined in the lower extremities. And active and passive range of motion values significantly increased following the intervention. And the F-wave measures that were taken also decreased. So it showed the F-wave is going to measure the spinal cord excitability, and so those values decreased significantly following the treatment. So in conclusion for this study, it is shown to be an effective treatment. There was a significant reduction in the motor neuron excitability through the 20 minutes after the treatment that they measured. They did mention in this study, though, that a larger randomized control study should be done to confirm these findings. And then my next study I looked at is going to highlight the neurophysiological and mechanical effects on spasticity, the functional impairments, and gait speed for post-stroke hemiplegia. In this study, there were 21 patients that were randomized into 2 groups. One of the groups solely focused on exercise, and the other one incorporated exercise and whole body vibration. This was a 4-week study, 3 days a week. All of the participants performed 15 minutes of stretching and active range of motion, and then each group spent time standing on the platform and did 3 sets of 10 seconds each of standing up on their tiptoes. Only one group, the intervention group, was experiencing whole body vibration during this period of doing a toe raise, heel raise. And so, again, the measures that were looked at to evaluate this effectiveness was the modified Ashworth, a functional independence measure, which is going to look at functional ability and motor impairment, motor control, and then they also looked at a 10-meter walk test. These were evaluated again at baseline, after 1 session, after weeks 1 and 4, and then longer down the road after the 3rd month and after the 3rd month and the 6th month from when the study happened. The results here, as you can imagine, it was a comparative study between the two groups. So the intervention group experienced a significant decrease in their spasticity score on their modified Ashworth, and the functional impairment measure showed no significant difference between the two groups. So those remained about the same between the two. And then the 10-meter walk test, the intervention group showed a significant increase in their scores for that test. So the conclusions for this study, it indicates that the whole body vibration combined with isometric exercise had benefits in gait performance and a decrease in spasticity, and that whole body vibration is a safe complementary or alternative therapy to decrease spasticity and increase walking speed. And so then the third study that I looked at is going to evaluate 4 hypotheses. The magnitude of an EMG activity will increase as the intensity of the whole body vibration increases. The second point would be that an increase in the whole body vibration induced muscle activity will be exercise dependent, and that the patient will experience similar effects bilaterally, paretic and non-paretic side. And an increase in muscle activity recorded with the EMG will not be influenced by motor impairment or spasticity. So for this study, they examined 36 patients. They performed 8 static exercises, 3 sets of 10 seconds each, under 3 different whole body vibration conditions. The first round would be no vibration, the second would be a low intensity, and the third a high intensity. Then the levels of the bilateral bicep femoris and tibialis anterior were recorded using a surface electromyography. And on this slide here, you can see the positions of those 8 exercises. So the first one you have is an upright standing position, and a semi-squat, and then a deep squat. We have a weight shift forward, a weight shift back, a weight shift from side to side, a forward lunge, and a single leg stance. Now obviously these exercises wouldn't work for every single patient, but in this study they were able to evaluate that these patients would be able to maintain these positions for 10 seconds at a time. The outcome measures used here is the Chedok-McMaster Stroke Assessment, or CMSA, and this is a lower limb motor score that they're taking. Again, they use the modified Ashworth scale and the surface EMG measurements to the bilateral bicep femoris and tibialis anterior muscles. So the results here, all of those hypotheses were proven to be true. So there was, when the EMG activity was increased, the EMG activity increased when the whole body vibration intensity increased. There was a greater increase in the EMG activity with exercise, so it proved that it is exercise dependent, that increase. And the patients experienced similar effects bilaterally, lower extremities, and the increase in muscle activity, they said was highly probable that it was not influenced by spasticity. So we know that high velocity movements increase spasticity, which can then give like a false reading on muscle activity and strength scores, and so they were able to determine that it was not likely that the EMG readings were influenced at all by any levels of spasticity or motor impairment. And so in conclusion, after looking at those studies, is whole body vibration an effective treatment to decrease spasticity in post-stroke patients? These studies that I was able to look at, yes, they indicate that whole body vibration can be an effective treatment alternative or complementary to traditional treatments such as stretching or other modalities used. It can be effective in helping to decrease that spasticity. The studies showed that walking speed was increased and their stability with gait, as well as decreased spasticity, especially when it was paired with exercise. And we all know that patients' abilities vary, and so the study did show that performing whole body vibration in a seated position is possible for those patients that are maybe more severely impaired. And whole body vibration did not induce any spasticity. There was no increase in spasticity, and vice versa. The patient's level of motor impairment or spasticity did not influence any increase in muscle activity. It was purely from the vibration, not the spasticity. So yes, all of these studies were fairly small, so I do think that there could be further studies done in larger groups to more generalize these results and confirm them. But overall, it does appear from this research that whole body vibration can be an effective treatment. So here are my references, and I would just say normally I would open this up for questions. So if you have any questions, feel free to email me. I will include my email address when I send this out to everyone. And thank you very much for being here.